Namaskar, I am Dr. Manish Sachdev, a practicing diabetologist at Thane, Mumbai. I am in practice for last 33 years. And all these years, I have been seeing diabetes and hypertension patients day in and day out. And we all know other complications of diabetes and blood pressure. But the one that patient is not easily able to take consultation for is erectile dysfunction. And friends, up to 75% patients of blood pressure and diabetes are having erectile dysfunction. And we must know that erectile function is defined as inability to maintain the erection so as to perform a successful sexual act where both the partners are satisfied. And we must know the causes of erectile dysfunction. We all know that to have good sex, good good erectile function, we must have sound mind, sound arteries and sound nerves. So when any of this component is harmed, we are likely to encounter the erectile dysfunction. So what happens in blood pressure? Due to forceful flow, the arteries get damaged. When arteries get damaged, they can't get filled up with the blood, which is the major component of erectile function. So to have good erection, we must have good arteries. So when you think of sex or sexual stimulus is there, nitric oxide is released and the arteries dilate and the blood is filled up in those venules, and that is maintained to have good erection. Simultaneously, the nerve sensations have to be intact so that stimuli reaches the nerve vessels to open up by releasing the nitric oxide and proper nerve stimulation. And the most important, if the patient is depressed or anxious, for example, performance anxiety or chronic depression associated with these chronic diseases, blood pressure and diabetes, patient is bound to have erectile dysfunction. So coming to the treatment part,